olecranon process. This one is the coronoid. Then we have here the ulnar notch, the radial notch for the radius to rest in. Head of the radius to rest in. With the radial notch. And then we have the trochlear notch. Trochlear notch. So basically, this bone will be like this. The olecranon process in the olecranon fossa, and the trochlear notch in the trochlea, surrounding the trochlea. Okay, and this is how the bone will be performing its action. Go like this. Okay, and you can see the coronoid process will fit in the coronoid notch. Okay. There is also the ulnar tuberosity. Okay, ulnar. You have also the ulnar tuberosity. For the lower end, you can see only we have the styloid process, and this one must be directed medially. Medially, you can feel it here. Styloid process of the ulna. For the borders, so we have the interosseous border laterally interosseous border, and we have anterior and posterior border. Then we have anterior, medial, and posterior surfaces. Okay. The most important muscle attachment here will be at the back of the olecranon. There will be the insertion of the triceps. Okay. And for the ulnar tuberosity, there will be insertion of the brachialis muscle. Brachialis muscle. Okay. For the articulation. This one from the elbow joint and the superior the ulnar joint and inferior the ulnar joint, and does not form the elbow joint. For the clinical importance, elbow dislocation, very important to know that when the 3 bones they are connected, that this one doesn't fit with this two. Okay, never mind. So what happens is, okay, so now we have the ulnar radius. So the ulna will be surrounding the trochlea. The radius will be surrounding the capitulum. So sometimes the ulna separate from the humerus. You can see that the only bone will be connecting the forearm to the humerus would be the ulna. You can see that the radius doesn't already, they are not fixed. So the main weight will be carried through the ulna. So if the ulna is dislocated, so this one we call elbow dislocation. Okay, how we know in the X-ray that the elbow dislocated is not fractured? There are three points. Those 3 points are very important. The first point are going to be the tip of the olecranon process, and then we have the medial epicondyle, and lateral epicondyle. You can see that now the elbow is already extended right. So if you draw a horizontal line pass through the 3 points, so this line will be horizontal, right? Okay, what happened when I do flexion? What happened? You can see that the line become triangular, right? The horizontal line become triangular line. So this one is a horizontal line. When flexion, it become like triangle. Okay. So this line will be disrupted in the X-ray. Why? Because when the ulna is dislocated downward, so when you look for the 3 points, you cannot find them at one line. There will be disruption in the extension. Either disruption of the triangle or either disruption of the horizontal line. Okay. So this one in case of elbow dislocation. Okay, because sometimes there will be supracondylar fracture. Could be confused along with the dislocation. But in supracondylar fracture, the line is okay. No problem with the line. Okay. For the ulna, now we know this one is the upper end, not the head. The upper end will be containing all the big head with too many processes. Okay. Then we have the interosseous border. This interosseous border supposed to be medially or laterally? Laterally.
Laterally.
Supposed to be laterally. Okay. And then the last point, which will be the posterior point or anterior point here, the fossae. This one, which is the trochlear fossa, must be anteriorly. So this one is left. So head up, trochlear fossa anteriorly, and the interosseous border laterally. So this one is left ulna.
It's medial, right?